All 5.
Oh.
Chiro cracks. Chiropractics for everyone.
Neck pain, shoulders, my back, like I think it's like in like the middle where my shoulders are.
How often do you have the neck pain, shoulders?
All the time.
All the time? It's every day, definitely?
Mm-hmm.
All right, worse in the morning or at night?
In the morning.
What does the pain feel like in your neck? Is it sharp, dull, achy?
Pressure, I feel like.
Your neck is
like,
a pressure?
I had an accident when I was younger.
All right, so tell me about the injury when you were little.
I got in a car accident and hit my shoulder and I went to the hospital. I didn't break, but I just always feel like sometimes feels off.
Okay, how old were you then?
16.
How often do you get a headache?
Every day.
When you get a headache, where do you feel it at the most?
Right here. It's like more like tension headaches.
So you wake up in the morning, everything's stiff, pressure, neck. Eventually that leads to a headache, some sinus stuff as well. How long have you had the IBS for?
Since I had my son, actually. I had a C-section, and I feel like the whole C-section, taking everything out, putting it back in, issues.
Okay, they didn't take everything. So have you ever had any massage or scar work, abdominal work done?
No.
So all of this sinus congestion pressure, they tried to correct it with surgery. Does your jaw still bother you every day?
Yeah.
Okay, looking at the feet first, there's a slight eversion bilaterally, and it looks symmetrical. Very powerful stride. Definitely in the gym, hitting it hard. All right, shoulders look pretty close to even. It looks like a right high shoulder, and the right arm swing is stiff compared to the left. Certainly a high right shoulder from the back is a little bit more obvious, and then a high right hip as well. Looking at the ear, we have a high right ear, high right mastoid process. That's good. Okay, I'm going to do a very gentle scan on the top of your spine, okay? You said you hurt the right shoulder, correct? Okay, I'm going to do a temperature scan with the back of my fingers, which are more sensitive to temperature. Nice and symmetrical all the way from top to bottom. There's no major variations. It doesn't even really get any warmer up here. Okay, do you have any tenderness here versus here, left or right? Are they the same?
They're the same.
Okay, lower SI joint, right, left, are they the same?
Yes, the same.
Okay, I'm going to push down on the top of your head. Do you have any pain, discomfort, or tension when I push here like this?
No.
Okay, let's go down to the left ear to shoulder. Good. I'm pushing down any pain, discomfort, tension here.
Nope.
Okay, you're going to feel my fingers on the back of your hamstrings, okay?
Okay.
Okay, looking at the bottom of the glute fold here, we're lower on the right, so that means the right hip has gone back like this. Looking from the top, the feet are even. There's no external or internal rotation. There's no rotations going like that. And then looking for hypertonicity, we're certainly more hypertonic on this left glute. So a little bit of compensation here, left glute. We have that right thoracic lumbar. Go ahead and bend forward and touch your toes. Okay, just looking for any curvatures, let your head relax. Good, go and stand back up. Good, no curvatures there. And I'm going to put some magnesium spray on this part of your spine right here and help reduce some of this muscle tension before I start cracking it, okay?
Okay.
Okay, breathe into this one. I'm going to squeeze harder, okay? Okay, one more time, deep breath in. I'm going to check the something called the Logan fibers, okay? So it's right next to your sacrum and coccyx over here, okay? So I'm going to palpate the gluteal maximus. All right, coming down to the top of the coccyx. Do you have any tenderness, discomfort here?
Not really.
What about here?
Yes.
Okay, so more on the left in these two spots. Ready? Here or here?
More in the middle.
Okay, we're going to hold this tension spot for just a moment. Is this one still tender down here?
Not as much now.
Better, right? Okay, how about this one up here? Is that one less tender too?
No.
Better?
Yes.
Here, go ahead and lift your right leg up in the air. Go down. Do that again. Right leg, down. Same thing. Left leg, down. Was one more difficult than the other, or they were the same?
I feel like my right leg feels more.
Okay, go and take a deep breath in. Good, sinking out. Let the shoulders go.
Oh.
Good, let the shoulders sink right there. Very nice. Good, sinking in.
Oh.
Good, now let it go.
Oh.
Nice. Good, shoulders relaxed. We're gonna bend the top. I'm gonna scoot you forward here just a little tiny bit.
Okay.
Okay, nice and gentle. Take a deep breath in and out. Shoulders coming up. We're gonna bring the hip down. Let the hips completely relax here. Okay, nice gentle breathing. Let the shoulders relax here. Let the hips kind of sink in. Oh, laying back. How's that?
Good.
You're just going to focus on the sensation of breathing. Let me completely control your head. And we're just going to focus on letting it drop. Good. As you breathe out, we're just going to follow just like that. And then a little push like that, okay?
Mm-hmm.
Oh. Pretty good?
Mm-hmm.
Good. Little push in that direction, just like that, okay?
Mm-hmm.
Good. Let the head drop. Shoulders drop. Sinking. Let the head drop. Let the shoulders drop. Good.
Oh, wow. I feel, actually my ears like cracked when that happened, so I feel like it's like opened up my my head a little bit.
Let it relax. So I'm going to start with the ileocecal valve. This is where the large intestine or the small intestine meets the large intestine, okay? First, we locate it by finding the belly button, which is here at the front of the hip, ASIS here.
Okay.
Connecting to these 2 points is where we begin looking for the ileocecal valve. Okay, I'm going to do a diaphragm manipulation here. Good, belly breath. All right, can I look at the scar from the cesarean?
Yeah.
Yeah, you feel how it's a little bit harder right here on top of the scar tissue right there. So like you can, what I would do is I would get some magnesium oil or magnesium cream and I would just use your thumb and I would just kind of like work this knot right here.
Okay.
See if you can loosen up, because maybe if all this IBS stuff started with this incision right here, so if there's scar tissue here, if there's less motion, less mobility, then that can interfere with this, especially lower digestive process. Okay, nice and gentle. This one's a little bit more aggressive than the other ones. Just follow the breath. We're gonna follow this next breath. Good, sinking in.
Oh. I felt it everywhere. I definitely feel less tense. I don't feel so achy. I definitely feel like my head is like less clogged. My back feels good. I feel like I feel like more straight, like aligned.
Okay, more tender on the left or right here?
Left.
What here?
Same.
All right, I'm gonna adjust this rib on the right, okay? It's the
Mm-hmm.
fourth rib down. 1, 2, 3, 4. That one right there, okay?
Mhm.
Tender?
Yeah.
All right, so I'm gonna place my finger on top of here to mark the space. I'm gonna place my hand underneath of this arm, let this arm relax on me. I'm gonna contact that rib with my thumb right here, okay?
Mm-hmm.
Okay, we're gonna contact like this. I'm gonna support on the other side with my hand. Now let your head come back and lean up against me like that. Okay, we're just gonna lift this up here, just like this. Let the shoulders relax. You felt it, right?
Yes.
All right, let's recheck it. Okay, is that still tender?
No.
It's better, right?
Yeah.
All right, I'm gonna crack your ears.
What?